Hi, welcome back to the next episode of the Keto Naturopath. I'm Dr. Carl Goldkamp. Today we're going to talk about something so fundamental you think everybody knows about this. At the same time, I think there's a lot of this thing we're going to talk about that most people don't know really how good it is. It's a supplement, or it's considered a supplement now. Maybe the FDA will step in and change that shortly. But it's called N-acetylcysteine, otherwise known as NAC, otherwise known as NAC. Choose your title. I like NAC. And I look back over my more or less 25 plus years of practicing since the mid 90s, and I've seen it used in so many different situations and really yield really profound improvement in these particular people's lives. And yet, there are people that don't get any benefit from it at all. What's that about? We're going to talk about that. One size does not fit all for really anything. So let's get started. Okay, so NAC, from autism to addiction and beyond, and I kind of stole that title from somebody else, as you'll see. So skinny on what NAC, N-acetylcysteine, the benefits, the drawbacks, and why it doesn't affect everyone the same. Little story of why I'm going down this road here. One is I, kind of recommend it to nearly everybody, but after a per evaluation of some sort, whether they're clients or patients. And there was this one client who I had recommended this to because with all the sort of glowing attributes it has, he took it for a week, maybe even a month, more or less. Nothing. He couldn't report back anything. His sleep didn't get better. His energy didn't get better. His thinking didn't get clearer. And so it was just a total bust. However, he gave it to his wife, who was a schizophrenic, on 2 medications, and it transformed her life. And you go, wow. I don't know what to call that average between those two, but that's how it is. You have to have a need. You need to have a place that this fits in. It's not for everything. And we'll talk about that. Okay. The first is the bad news. I wasn't just kidding when I said about the FDA. So it started about 1.5 years ago, pretty much at the beginning of COVID, that the FDA started to step in. NAC may soon no longer be available if the FDA gets its way. And this was from one of the journals that I read or whatever. FDA sends warning letters to 7 companies illegally selling hangover products. In other words, they called NAC to help your hangover. Between you and me, it does. But that was their claim. And once you start making claims to a supplement, it becomes drug-like and it's not a drug. And this is exactly the issue. However, on that same blog that I was reading, there was interesting comments. One is, you can't get NAC on Amazon now, which is true, which means it works. Another said, now the FDA has swooped in like a vulture and banned it. Not quite, but it's about to. Somebody else said, my father's doctor placed him on NAC for his brain fog. We have seen a big difference with his word recall and will continue to use NAC. That was for a brain thing. So we're going to explore that a little bit. So in the middle of the lockdowns is when they were thinking of pulling this back. And here's why. It's a little story on that. At a time in which it really could help a lot of people. So N-acetylcysteine, supplement, drug, or both. The history is important. So NAC comes from an amino acid, cysteine, L-cysteine. It's been available as dietary supplements for decades. But now the FDA is warning companies that it cannot be legally included in supplements. The tug of war between the industry and the FDA is confusing. The highlights the great differences in supplement and drug regulations. NAC was first approved by the FDA as a respiratory drug in 1963. Listen to this. It's also used to prevent serious liver damage from acetaminophen poisoning. In fact, it's recommended by the World Health Organization as the sole antidote, if you will, for acetaminophen, Tylenol poisoning. But it's been available in dietary supplement products for decades. The ingredient itself is likely safe for most people. The FDA has pushed back on the use of NAC supplements since 2010, but it ramped up significantly this year. That was 2020. Some speculate this is due to new clinical investigations into the use, studies, in other words, research studies into the clinical investigations into the use of NAC for COVID-19. The FDA claims that there is no evidence that NAC was used as a supplement prior to its use as a drug. So including NAC in a supplement makes the product an unapproved drug and thus illegal. Most recently, several dietary companies received warning letters for making hangover treatments about their product. And it goes on. It really has to do about glutathione. When you deplete your body, and we're going to get onto this as a theme, when you deplete your body of glutathione, and most of your glutathione is in your liver and is made in your liver as a detoxification agent, among others. And so when that gets low, you're going to have a lot of liver problems, right? So with alcohol, which is a toxin, it helps detoxify alcohol. And when you're low on it, you'll have a bigger hangover. CRN files citizen petition regarding FDA's objection to NAC supplements. This was in December 2020. Amazon has pulled their products off, and so have a number of other companies. Brief history of NAC. Much of what we know today, we knew about 100 years ago. Let's go back. So here's a study that came out in actually it was done in 1929. It was published in 1934. It's safe to say neither of us were around then. But what it says, long story short, it says lactic acid and glutathione content of the blood of schizophrenic patients. This is amazing. This was done back then. So on the year of the ultimate stock market crash, and in the middle of the Depression, these are Depression years, by the way, you had this rather foresightful study, in taking blood from schizophrenics. So what did they say? What did they find? And here's where you can go online and find that. Still, by the way. So conclusion is lactic acid is not removed from the tissues of schizophrenic patients in a average state as readily as it is from normal subjects. This failure may be due in part to a decrease in the content of reduced glutathione. What does NAC do? It's a precursor for glutathione. Okay then, so where does lactic acid come from and what does it mean? Well, lactic acid is a waste product of anaerobic respiration, stress in other words, right? So when you run, for instance, right here, you go into what they call an oxygen debt. You're now running without oxygen. You now have a rather inefficient but possible way to generate energy. So you do that for a while until you can't. But you generate a lot of lactic acid, which eventually gets paid back and gets converted and gets taken care of. So in times of intense energy needs, such as during a sprint, muscles twitch, anaerobic respiration without oxygen is because it's a quicker way to produce energy. So you go, well, that's the brain. It happens throughout in all our mitochondria in the same way. So there's a lot of brain stress, same with drug addiction. Brain stress is going to deplete the glutathione, and what are we going to get into? Okay, here's just an example going further. This is now 90 years later. Reduction of plasma glutathione in psychosis associated with schizophrenia and bipolar. Basically saying it's the same old, same old. Here we go. Yep, it was low 100 years ago, still low now. And that's where you can get the article. Okay, reduced prefrontal cortex, right here, glutathione in schizophrenia, depression, and bipolar. Why is this such a big deal? This part of the brain, your frontal cortex, is where you actually do your thinking, your reflecting. What should I do today? Should I do this? Your conscience, if you will. It's where you have this sort of secondary voice of, should I be doing this or should I not be doing this? Should I be doing some work right now or not? Should I not be arguing with whoever? Should I not be? This is where you get that. So you think of people who don't have that ability to reflect, schizophrenic, bipolar, depressed people, they're just depressed. Addicts, they're just, they need what they need. There's no discussion. There's no middle ground. There's no gray. They need what they need. We'll get into that. So prefrontal cortex, it's executive function. That's where most people call thinking, happens here. Reflections on their own behavior. Why NAC doesn't affect everyone the same. So, this topic is so well covered in so many other blogs and YouTubes. I mean, spectacularly covered in the biochemistry. I am not going to go there. But I can tell you what I can do as a physician, how I assess a patient. It would make it a reasonable assessment why somebody would need this or not. So let's take a look there, okay? Maybe that will be a different light you haven't seen before. What you're not being told about NAC is going to be what will determine how useful it is for you. What? Let's look at genomic predisposition, and intracellular nutritional deficiencies. This is how we determine a personal need for a number of things, but certainly NAC is part of it. I'll show you. Okay, so what I'm looking for here, these are 3 mutations that I use as kind of my first wave, my first initial evaluation. There's about 75 that I look at, but this is the first hub that has to do with the folate acid cycle and the methylation acid cycle. We're not going to go too deep into that. I'm just showing you 3 mutations, otherwise known as SNPs, SNP small s, single nuclear polymorphisms. It means they have one nucleotide off, one little piece, different mutation. And we call that a polymorphism. So it's a SNP polymorphism. And they're common enough that people will have problems with being able to methylate their hormones, methylate B12, methylate their folic acid, and that will make for a number of other problems. So people who have these kind of problems, well, you can say that they would have cleft lip, they would have spina bifida, which is the incomplete closing of their spinal casing around their spinal cord. They will have autism, they will have dyslexia. So it's a lot of associated complex conditions that have to do with these particular mutations. I speak to this as a pretty severe dyslexic, if you ask me, that I have all 3 of these mutations. And of the people that I've worked with, this is something I've been looking into since the early 2000s, I should say, 2004, 5, and 6, and I actually started lecturing on it after that. And so it is a big deal, and it does affect people, but not everybody has this. So it's not like, oh, you have this. And it's not like, oh my gosh, you have this, you gotta do something about it. There are people that I met that have this, are perfectly functioning, don't have any particular problem, so why address it? But some people you address and you go, wow, Johnny suddenly, his learning behavior suddenly improved. His depression improved, or bipolar improved, schizophrenia improved, OCD improved. So these conditions have to do with these particular polymorphisms. The problems with the methylation cycle and problems with these mutations in the folate acid cycle directly have to do with things like schizophrenia, bipolar, obsessive compulsive disease, the spectrum, which is everything from severe autism to Asperger's and dyslexia. They're all spectrum disorders. Okay, so how do we do that? We basically send away to, and there's plenty of companies that do this, by the way, they will give you an analysis of your genomic SNPs. Right? We're looking at SNPs now. So we're looking at those same 3 that I just showed you. Now I'm just lining them up, and I'm choosing somebody else, not myself this time. And I look at these 3, and here's person, these are 2 mutations. If you have this mutation, you have a reduced ability to methylate B12. And if you have this on both genes from mom and dad, you have a very reduced, up to 70%. That's considerable. That's one of the correlations with cleft lip, spina bifida, and everything I just told you about. And here's another mutation and another mutation. So this is a pretty severe, this one down here is not so bad. Let's go back to that picture again. So of that I just showed you, severe here, not so bad here. So if you think of these as cycles, they are kind of almost broken. They have a big backup. I used to call them traffic circles. Traffic circles have a backup. Okay, this person's family history was diabetes and addiction. Not just him, but back a number of generations. That fits for what we're seeing here. Okay then, now to the nutrient assessment. Nutrient assessment, we look at, this is intracellular, this is a company called SpectraCell, and it looks at intracellular nutrient deficiencies. So let's go across. These are some of their panels. Right away, it goes glutathione's deficient there. Cysteine, which is one of the components that's used to make glutathione, is borderline deficient. Let's go over here. Glutamine is another component that makes up glutathione. That's deficient. So do you think this person's going to be deficient on NAC? And NAC is actually kind of hard to measure. So you measure things indirectly and put the picture together. And there's others. I'm not going to get into all the other things. So this is a picture of where these deficiencies are. This is glutamine, this was serine, didn't go into that one. ALA, deficiencies that this particular person had. These are deficient, these are borderline. And this is your ability to make energy in your mitochondria, long story short. So just look at this as a garden hose, as a sprinkling system that has a few obstacles. How well do you think some of these plants are going to get watered? Not very well. So therefore, you need to fix some of these nutrient deficiencies to alleviate some of these traffic jams. So this person would probably say, I'm doing okay, I'm just kind of tired. And to compensate for that, he'd probably be overconsume coffee. He'd probably overconsume, he or she would overconsume coffee, overconsume stimulating drugs because they needed to get up. But their default state with these deficiencies was they were slow. Okay, now let's look at some of their blood tests. These are same group of guys that I happen to look at, and I just want to outline some of these things. We're looking at platelets. This is a whole, there's a cholesterol and so on and so forth. We're not going to get into everything. This is the individual we're following. I want to point out, here's a homocysteine level, elevated. They're all have high inflammation except for this one guy. And they all have, what else can I say? Neutrophil lymphocyte ratio is something you need to look into. And you might say, one has an issue here. So these are the things we look at to sort of say, what is the norm of this person? Where can I intervene? So far, I'm getting a handle of, if I look at some of these deficiencies and he has a predisposition, genetic predisposition that I can support, I think I could probably change this person's life. All right, then we'd look at their diet. I just used, this is actually a different person, but this is on Chronometer. I have people do a week's worth of Chronometer. So I get to live with them for a week. I get to see what they've eaten for a week. And this is how I go through that. And from their protein, carbs, and fat, that's your macronutrients. And then I can track down all the micronutrients, which I generally try not to look at. I only really look at the omega-6 and omega-3 total for the day through that. But I can get more detail if I'd like. So now we get an individual. I just wanted to throw this into, we talked about schizophrenia already, is that, way up into 2006, here we're finding that, wait a minute, schizophrenia can also be treated with, there's a number of schizophrenics that are high in homocysteine, and what they need is B6, B12, folate, and to treat their homocysteine. So let's just see what this is. Look at this. We find that here's your homocysteine, and here's, here we go, B6, B12, folate, there's B2. So it goes right along with, this whole little methylation package, this methylation of folate acid. So this picture now is saying, well, there's a predisposition for these people who have schizophrenia, would be my take. If I went to a schizophrenia board or where they're living and saying, can I just look at your genes? It would be a very high percentage. This puzzle fits by saying they're predisposed. In other words, they're very vulnerable in a culture that doesn't have good nutrition, in a culture that's very stressed, financially stressed for most people. They are a perfect demolition to happen. And so if you can fix this and support them, they'd probably be much more productive and happier in their own lives. Okay, so what is NAC doing? It's the sole precursor to glutathione. Let me show you some things. Okay, so what I want to do here is briefly saying, so what's going on with NAC? What's the point? What's its function? I'm not going to go deep into this. It's covered elsewhere beautifully. So I'm just going to give you the nub of it. The nub of it is this. Consider it a sponge that mops up free radicals throughout your whole body. That's glutathione. So NAC is a precursor for that. So it'll make sure, it's an insurance policy that you have enough sponges to mop up. So it's enough of the biggest antioxidant in your body. It's been shown that when you are low on glutathione, a lot of local inflammation that has a purpose, that's what your immune system's about, is about injecting into particular situations enough inflammation to stop that invader, be it bacterial or viral or fungal or whatever. But if you don't have enough sponges around, just like the forest fires in California, a little match, which is easy to blow out, ends up being a big forest fire. And that's exactly what happens here. So when you start bringing in NAC, you're now bringing in the water, the planes, the firefighters, you have it under control. So you're most likely not going to be having a huge forest fire, a huge systemic inflammation. Since most diseases today are of chronic inflammatory conditions, which really didn't exist in the volume that they did before, this is important. Okay, so we see oxidation. When we breathe, we're oxidizing. We're oxidizing fats, carbohydrates, and protein for energy. That means immediately there, just on breathing, we are creating free radicals, about 2 or 3%. So that needs to be squelched out. And certainly this helps out here. This is my short story about saying what happens to a normal cell that gets affected by free radicals, otherwise known as ROS, reactive oxygen species. Well, it eventually dies, right? So you need to balance that, and that's what this is. So glutathione is the big balancer. Okay, so the benefits are glutathione helps with all these things: antioxidants, protein synthesis, detoxifiers, especially in your liver. Glutathione is mostly in your liver, immune booster, DNA synthesis and repair, enzyme activation, amino acid transfers, and used in the brewing industry. Okay, now for NAC, which is the precursor, not what I just showed you. This is known. These are conservatively well studied, used in bipolar. Sounds familiar. Used in COPD, lung, high blood pressure. That's pretty much secondary, caused by lung concerns. Infertility, polycystic ovarian syndrome, diabetes. Okay, here's a few studies that I think will really help illuminate this. So you have NAC reverses mitochondrial toxicity. This is a big deal. You have mitochondria throughout your body and in your nerves, so you need to protect them. Both, it's not just muscles, it's not just heart. So what they did is they, in essence, overdosed mitochondria with vitamin K3 called menadione. And so it killed cells. So they called NAC reverses mitochondrial toxicity by, stop the apoptosis. So here's that line at the bottom is all that those who had mitochondria that had NAC and those that didn't. Extreme difference. And that's 2001. Here's NAC reduces methamphetamine-induced apoptotic cell death. These are addicts. These are meth addicts, and they can't stop having enough methadone, and it's killing their nerve cells. Giving them NAC slows down that process to the point it doesn't stop it completely, but it slows it down remarkably. And so you'll notice in the bottom it says Parkinson's disease journal. What is that? What's the connection with methamphetamine? Why would you care about this? So the connection between methamphetamine and Parkinson's is that this is methamphetamines is considered one of the initiating events for Parkinson's to start. So if you know any meth addicts, you'll notice they probably have a slight tremor. So this is neuroprotective. This is what this is showing. This is working on nerves now, neuroprotective. Okay, NAC for therapy-resistant tobacco. So helping people to stop smoking. One is those who are on NAC and those who didn't, placebo. They said smoked fewer cigarettes over a period of time. They suffered less from carbon monoxide toxicity. So it was protective. And they weren't as depressed when they stopped smoking. That's 3 wins. Effective treatment of NAC on C-reactive protein. You saw that in the lab. C-reactive protein is an inflammatory marker, and so is interleukin-6 considered to be the cause of 2014. So it says inflammation is obliterated by making sure there's enough glutathione available. Look at the difference there. Huge drop. Huge drop. Okay, NAC in idiopathic pulmonary fibrosis. That is the scarring of your lungs. Idiopathic means they don't know the reason for it, but that scarring would slow down. So people were having scarring lungs, perhaps from where they worked, whatever, it slowed down that process tremendously. That's why it's also used in cystic fibrosis. And that was from New England Journal of Medicine. So pretty straight up stuff, pretty conservative reports here. Reduction of blasts induced by mild TBI, traumatic brain injury by N-acetylcysteine. So what this is over in Iraq, in which there were soldiers that were affected. Their van, Humvee, was blown up by an IUD. So they basically gave Group A NAC early, and to see what happened. And they had 85% of those who were given NAC orally after they were taken in while they're being treated suffered no consequences. And then the same thing was later. Obviously, later is later, so it's a smaller piece of the pie. But that's tremendous. That's absolutely tremendous. All right, a meta-analysis of NAC in depression. Just saying people with depression, major depressive episodes here, take NAC. These are all the studies. I'm not going to go through that, but what this means is solidly appropriate for use in depression. I want to go back to what I showed you before, slightly different orientation. Many people just can't create enough glutathione. So that's the issue we're dealing with. They're vulnerable. They have enough to do life, but given added stresses of life, whether it's disease, whether it's environmental toxins, whether it's emotional toxins, they're stressed all the time. All these things, they deplete themselves of glutathione. And then things just start to get worse and worse and worse, whether it's joint pain, chronic fatigue, can't think straight, et cetera, autoimmune, name your cardiovascular. So putting in NAC at this junction, there's cysteine, glycine. So glutathione is made up of cysteine, glycine, and glutamine, which is thought to be always abundant, conditionally essential. And there you go. There's your glutathione. It's a small wonder supplement, if you ask me. And that's why, because it is so profound, that the FDA is saying, wait a minute, remember in 1963, this was labeled a drug because it saved people's lives from Tylenol toxicity, acetaminophen toxicity? We should make it a drug again. No, we should not make it a drug again. I just want to go back. Remember this guy we're talking about and his predisposition? He's in essence nearly blocked with one enzyme, blocked with another, partially blocked with another. His diabetes and addiction for a family history. Here was his nutritional deficiencies. Glutathione, down. Glycine, borderline deficient. Serine and glutamine, deficient. So these are components of, let me just pop back to that one. Here's the serine. There's the glycine. So this is how we look at why this is the guy in the yellow, how we can help him. He would be tremendously improved by NAC. Certainly other things as well, but he is just, when you need to make a profound recommendation, something he can continue taking, ideally he'll change his environment. Ideally he'll have a better nutritional diet, work on those bigger issues, but now you have something that can really make a big difference right out of the gate. Add omega-3s to these and you are home free for a while, nearly home free. Here's a study that actually came out of New York City and upper New York State on the therapeutic blockade of inflammation in severe COVID-19 infection. It was amazing. So what this was about is dealing with a group of 10 people that had severe. So what is severe? Severe is they are on what they call an ECMO machine, which takes the blood and then circulates it through and gets oxygenated outside of the body because your lungs are in such bad shape. I mean, they are in such bad shape, they're taking that responsibility and putting it on a machine. So it's called ECMO for short. And these are patients that have a vulnerability. Remember I told you how some just can't make enough glutathione? Well, they have a condition called glucose 6-phosphate dehydrogenase deficiency. And what that means is that they are very sensitive to extra free radicals in their body. And so they were given hydroxychloroquine, which is not a bad idea for most people. But for these guys, it's a pro-oxidant therapy. No, it's a big gun meant to kill the virus. It also makes a lot of free radicals. So consequently, these 10 people are predisposed to what they call hemolytic anemia. The red blood cells will pop if they have too many free radicals. So adding hydroxychloroquine, a pro-oxidant therapy, began to pop their red blood cells. So what they did, they put them on IV, high dose NAC, and it was dramatic. And it said NAC elicited clinical improvement and markedly reduced CRP, inflammatory marker, in all patients and ferritin in 9 of 10 patients. NAC mechanism of action may involve the blockade of viral infections and the ensuing cytokine storm that warranted follow-up. Isn't that amazing? That's impressive. So that was IV big. You can't get that by orally, but you can start at home if you start feeling fluish. Here's another. They did plenty of graphs in that study, and this is basically saying these gray boxes are where they gave the IV of NAC, and you can see it immediately drove down their CRP and it immediately drove down their ferritin. Very impressive. So I go back to where I started. This is semi-miraculous, very helpful in so many situations, but it doesn't help everybody. I told you about the guy who I said, you might want to try NAC. I forgot what the context was exactly. He said it did nothing for me. I tried it for myself. And I go, that's too bad. I felt foolish for recommending it. He had to spend money on a supplement. It didn't work out. But he gave it to his wife, who was schizophrenic, and it transformed her life. There you go. Till next time.